What comes to your mind when you hear the word COVID-19? Feelings of anxiety, stress, fear, thoughts of death? I want to share some good news. Want to make you feel lighter. Join with me as we discuss good news about COVID-19. COVID-19 cases are increasing in India. It is 60,000 per day, maybe more than that. Do we have to really worry about it? All over the world and in India, we doctors and the medical fraternity have learned to treat COVID-19 in a better way. Do you know what is the mortality rate in India? It's 2.5%. What about in Karnataka, a home state? It's just 1%. Isn't it a good news? In the early phase of pandemic, we used to do only very few number of tests. Even if a patient had symptoms of COVID-19, our laboratories in India did not have the capabilities to do a large number of tests. Now what is it today? We are doing 6 to 8 lakhs tests per day now. That means a person with COVID-19 now have the access for COVID-19 tests. Isn't it a good news? Now let's look at the number of tests that was available in the early phase of pandemic and now. In the early phase of pandemic, we had one test, which is called the RT-PCR. It looks for the genetic material of the virus. It is also the gold standard test, but many of the hospitals did not have the capability to do that test. Now today, we have RT-PCR, which is the gold standard test. We have antigen test, which is a quick and easy test which can be performed by many centers. And another one which is called the antibody test. The antibody test will let you know whether you have been infected by the virus and recovered or not. So isn't it a good news to have different types of tests? Yes, it is. COVID-19 infection in humans can be broadly divided into two phases. The first one, the multiplication phase, and the second one is body's response to this. So in the multiplication phase, when the virus comes in contact with humans, it gets attached to certain receptors in our nose and throat, and it finally reaches the lungs. In the lungs, in the cells, it starts multiplying and becomes millions of copies of virus. This is the multiplication phase. There is a drug called remdesivir which is approved, which actually inhibits the multiplication phase. So there is a good news. We have a drug for the multiplication phase. What is the second phase? It is body's response. Body respond to this infection by activating certain cells called the immune cells. The immune cells will start producing certain chemicals called as chemokines. In patients who get severe disease, these chemokines are in excess quantity and it starts affecting all parts of the body. So is there a drug for that phase? Yes. Dexamethasone is a commonly available drug which is now proven that reduces death in 35% of very severely ill patients called as ventilated patients. So isn't it a good news? Yes, it is. Do you know how much time it takes to develop a vaccine? 10 to 15 years. We have to be absolutely sure that the vaccine is safe. For that, we have a rigorous process. In the initial phase is called as the preclinical stage, where we do experiments in lab and do animal studies. Once we are sure that there is no toxicity, that is where we do the clinical evaluation, where we give the vaccine to people in real settings and to see the effectiveness. With the advancement of science and technology, we have moved very fast for COVID-19 vaccine. As of today, if you look at the WHO vaccine update, There are 147 vaccines currently at different stages of development. Of them, 138 are in the preclinical stage and 29 in clinical stage. And 6 have entered to the very last stage of clinical evaluation. Isn't it a good news? So we can expect a vaccine by January or February 2021, which is an extraordinary success. But I have a feeling that most of the people would have acquired immunity by that time. It would be at that time most useful for healthcare workers and the vulnerable community. Isn't it a good news? People infected with the virus can have mild disease. Some people may be totally asymptomatic. Some may be having moderate disease and some may have severe disease. Will all of them have good immunity? This is $1 million question. Till now, we didn't have much of an answer. The results have just come less than a week ago. The answer is a big yes. So scientists have documented that you can either have protective antibodies or not. If you belong to the group where you do not have protective antibodies, there is another specific cells called as memory T cells who actually can produce the antibodies when you get the next exposure to the virus. So isn't it a good news? Yes, indeed. If you get COVID-19 infection, how long will the immunity last? Will you get a COVID-19 infection again? The earlier time we were talking about antibodies for 3 months, 6 months, whether we will develop antibody. Now, what does the recent evidence say? The top journals in the world, Nature and the Cell, points out that we may have a long-lasting immunity, decades or maybe lifelong. Isn't it a good news? Yes, it is. Is the worst over? Personally, I feel yes. It's a good news again. In the community transmission phase, first the number of cases goes up, then it plateaus, then it comes down. Usually at 35% of the population gets affected, it becomes plateau, and then at 50% the virus becomes less impactful. Now the recent studies which has come out from Mumbai and Delhi points out that 25 to 29% of population are affected. So it's a good news, the worst is over. So what do we do with all the good news that we have heard? Continue this simple yet effective practices of hand washing, mask and social distancing till we hear that we have killed all the virus, eliminated the virus and the evidence is there. And share the good news with everybody.